Great. So thank you very much, Ariel, for inviting me. I'm very happy to be here. Also, thank you to Jeroen for accepting to discuss what is not really a paper. So what I will be presenting today is very much work in progress. So it is part of a grant application that I've submitted to NVO here in the Netherlands. But what I'll be presenting today is probably more questions than answers. So I've been collecting some data. I have been delving into building some theory to try to understand the connection between welfare states on the one hand and immigration control. Maybe for this to be a little bit clearer, let me start with, let's say, a puzzle. This is a graph that is quite familiar to welfare state scholars. This is a graph that shows the evolution of public social spending as a share of GDP since the late 19th century until now. So the main story here, and you have data for 5 countries, so 5 European countries, the main story here is that there's been a massive expansion of the welfare state. So from a relatively marginal task that the government would do in the late 19th century, social spending, social protection for health, pensions, unemployment has become one of the biggest things that governments would do. So if you take that, for instance, as a share of total public spending, here in the Netherlands, about 50% of everything that the government spends goes to some form of social protection program. Especially pensions are probably the most expensive in all countries. So massive expansion of the role of the state in the economy and of the role of the state in social protection. Now, let's look at another graph. And this is a graph that is probably less familiar to welfare state scholars, but is probably maybe more rings more bells for immigration scholars. This is a graph that shows an index of immigration policy openness, also in 4 countries this time, so there's not a total overlap in the data that I've taken from Margaret Peters, who's a political scientist at UCLA, was built along an indicator of low-skill immigration restrictiveness for a number of countries, including European, but also new immigration countries like Oman, I think the United Emirates, over a relatively long time period. And what you can see on this graph is that there's been a massive movement of restriction from a period in the 19th century where most states would exert little control on who enters the territory. There's been a quite important expansion of laws to regulate labor mobility across borders. So this data comes from Peters. This data before came from, it's a time series that I built that merges data by Lindert, who's an economic historian at Berkeley, I believe, together with recent data from the OECD. So mass expansion of the welfare state, mass movement of immigration restriction. If you put these 2 things together, you can see that there is a relatively clear correlation, at least, between these 2 things. Between a time period here that would be the 19th century, where you have relatively, little spending, about less than 1%, and relatively open immigration policies, to a movement where the progressive expansion of social spending is accompanied with a movement of restriction. So I've built, let's say, a fit line. We don't know whether this relationship is linear or not. That's just to give a broad idea. If you want to look at how these 2 things evolved over time, immigration restriction and expansion of welfare spending, we can look at the average of all these 2 things. So this is based on a sample of, I think, 10 or 12 countries. I think that's 12 countries, so where the data on social spending and the data on immigration policy restrictiveness actually overlap. And you can see different phases. That would be a first phase in the late 19th century up until the 1930s, with a very small expansion of the welfare state, with the first steps in welfare expansion. If we think about Bismarck's social policy programs in the late 19th century, but that resulted in a relatively small expansion of social spending as a total share of GDP, but a clear movement of restriction. And then, well, we have a gap in the data, but we can see a move, quite a massive move here to the right for you, up to 1960, with a massive expansion of the welfare state and a little bit of restriction. Then another movement of restriction around the mid-70s. For those of you who work on immigration policy, that also sounds pretty familiar. That's the Anwerbestop in Germany. So the crisis in the mid-70s resulted in a number of movements of tightening in immigration control in a number of at least European countries. And then things get a little bit messier. But what I wanted to show is that there are clear sequences. Now, we have two evolutions here. We have immigration restriction and expansion of the welfare state. Now, the big question that I'm interested in this project is to see whether these two evolutions are independent or whether they are connected. And whether, if they are connected, in what way are they connected? So what is the cause? What is the effect? What comes first? And how can we build a causal story that connects the expansion of welfare programs, also with a focus on different types of welfare programs and immigration restriction. Also looking at different types of immigration restriction. Now, in order to do that, I've been trying to think about what was there in the literature in terms of theoretical connections that could link these two things. So why would the expansion of the welfare state be accompanied with a closure of borders? There are different ways to understand, to try to envisage this relationship whereby more border control could be either a necessary condition for the expansion of the welfare state or a consequence of the expansion of welfare programs. The first set of reasons are actually quite widespread in the economics literature, starting with Milton Friedman in the late 70s, who basically said that the reason why the United States no longer had the system of open immigration that they had before the First World War was partly the welfare state. And the reason is that if you have no state involvement, no social protection, it makes it possible to have open borders. So the main idea of Milton Friedman was that open borders and heavy state involvement in social protection were two incompatible things. And the reason is that if you have generous welfare programs, it might attract either low-skilled or poorer immigrants who, rather than migrating to jobs, will go to migrate to welfare. That's one of the sentences that he uses actually in a conference that you can find on YouTube. So migration to jobs, from his point of view, is good. Migration to welfare is bad. So that's why if you have a big welfare state, it creates a big incentive for policymakers to close borders, to prevent this kind of bad incentives. This is essentially an extension, or rather an early formulation of many arguments that you hear nowadays about the relationship between welfare and immigration, especially welfare tourism. That's something that played a really very important role in the run-up to the Brexit referendum, for instance. Now, the other set of arguments that can be used as, that can be understood as rationales for policymakers to close borders to protect their welfare state have to do more with the political logic of support for redistribution. A major question, if you have extensive welfare programs, is will your citizens want to pay taxes that will fund these welfare programs, will also benefit people that don't look like them? And that's really a very kind of fashionable argument in the political economy literature. Nowadays, it's the idea that immigration tends to undermine support for redistribution. And that's one of the arguments that also been used to explain the low levels of social spending in the US in comparison to European countries. So the US has had massive immigration, as you know, in the 19th century, but also a quite more politicized level of ethnic divisions. Basically, the argument was that the white majority didn't want to pay taxes if they knew that welfare would be used mainly to benefit African Americans. So that's the argument that Alberto Alesina, an economist at Harvard, has been making, that has made quite a bit of noise in the literature. But these two things can be used, can be possible rationales for policymakers to try to restrict immigration. If you want, let's say, a Dutch example of this second logic, you can hear that also quite often in political discourse. This is a statement from Geert Wilders in the 2010 elections, basically saying that Henk and Ingrid pay for Fatima and Ali. So the idea that native people won't want to pay welfare programs if their tax money goes to fund social programs that are perceived, whether it's the case or not is another issue, benefit mainly immigrants. Now, when we talk about this relationship between welfare and immigration control, it's important to have in mind that control on immigration policy is exerted in different ways. So you can think about external barriers. That's what I mentioned just before. So that's what the index that I presented in the beginning actually measures. That's the conditions that immigrants have to fulfill in order to enter a country or to be able to settle and work in a country. Now, this type of mechanism of immigration restriction also entails some costs and benefits for different groups in society. And one, let's say, prominent group that has played quite an important role in this kind of politics is representatives of labor. Labor, throughout history, even if things have been changing over the last decades, has been quite favorable to this type of restriction, for the simple reason that if you just control the number of people who come to the country, you just limit the supply of labor, which incidentally has an impact on wages. So if you maintain labor shortage, in general, it's gonna make wages rise. Whether this is politically feasible in some contexts, and whether employers will agree and whether the government will agree is another issue. But traditionally, this has been really one of the favored ways whereby trade unions have sought to exert control. But this is not the only way where you can try to shield the welfare state from the potentially negative impacts of immigration. I'm talking about the potentially negative impacts of immigration because this has been really a leitmotif of policy over 100 years. Now, whether immigration is actually positive or negative for the welfare state is a whole different issue. We've seen that in the run-up to the Brexit referendum, actually immigrants in the UK contribute more to the welfare state than what they actually receive. This is the case actually in a number of countries, including the Netherlands. Now, if you cannot really resist the entry of people into the labor market and into a country, there's also different ways whereby you can restrict their rights to access social benefits. And that would be internal barriers. So you basically let people enter, but you limit their entitlement in accessing different welfare programs. That can take place through different channels. You can either use nationality, which has become more difficult in recent decades with rulings of courts, especially the European Court of Justice, or you can apply other kind of eligibility requirements, residency rules, where people need to have lived in a certain country in order to access social benefits, but also more, let's say, complicated and subtle ways of restricting eligibility. That would be rules, for instance, where you contribute to vesting periods. That's the word I was looking for. Vesting periods are rules where you contribute to a welfare scheme, but you can only receive something in return if you have contributed for a certain amount of time. Let's say 20 years. let's say I work here in the Netherlands, so there's a vesting period of 20 years. I live here for 10 years, I contribute into the pot for 10 years, then I go away to another country that doesn't have an agreement with the Netherlands, then all my contributions are lost. Or I can take something away, but I give up on some employer contribution. So there's all sorts of ways where entitlement can be restricted. If you think about the distributional consequences of these different mechanisms, this is different, for instance, from the point of view of trade unions, because if immigrants are excluded from some welfare programs, which might also mean that they don't need to contribute, they can potentially constitute unfair competition to native labor, because employers will need to contribute for native workers, but not for immigrant workers, which creates an incentive to actually hire migrant workers. Think about countries like Saudi Arabia or the United Emirates, where they bring in a lot of people from especially Southern Asia, Pakistan, India, Bangladesh. They have very few rights compared to those in Western Europe, which means that they are a quite dependable and expendable workforce. Now, how can we think about ways where this connection might work empirically? And what I will do in the rest of the presentation, in the time that I've left, is to try to present some concrete cases. Well, to give essentially two examples, one from Britain and one from France, to try to see empirically, in a qualitative manner, how political actors could connect, or the instruments that they could use to connect welfare programs and immigration restriction. And I will start with Great Britain. Great Britain is an interesting example because, well, there's quite a bit of material on it, but Great Britain was a country, just like many others in the 19th century, that didn't really have any legislative instrument to control the entry of immigrants into Britain. This is a statement from Earl Granville in 1852, who was the Foreign Secretary, who stated, I think, in Parliament, that by the existing law of Great Britain, all foreigners have the unrestricted right of entrance and residence in this country. So even if they wanted to, there was no legal instrument that the British government could use to restrict entry into Great Britain. And many countries in the mid, especially from the 1860s onwards, actually liberalized or even no longer enforced a number of instruments that they would have at their disposal, which led to well, Great Britain becoming a safe haven for a number of refugees from other European countries in the 19th century, which also created a number of tensions, especially at a time where Great Britain also had let's say, a relatively advanced system of poverty relief, because it was also one of the early adopters of the Industrial Revolution, which led to massive population movements, more poverty, especially concentrated in urban centers, compared to other countries that didn't really undergo this kind of mass movement. This is a statement, this is a leaflet from an anti-immigration group called the British Brothers League, dated from 1902. The British Brothers League was a little bit the forerunner of UKIP, if you will, where here in 1902 they organized a great public demonstration calling for restrictions of the immigration of destitute foreigners who could potentially represent not only create a pressure on wages of native workers, especially in the West End of London, but also potentially represent a burden on the public purse. So this leaflet is actually quite striking if you compare it to contemporary concerns about welfare tourism. The main targets of anti-immigration sentiments in Britain in the late 19th century were especially Jewish immigrants from Eastern Europe that were fleeing persecution, pogroms in Eastern Europe, and that came to Britain, which created some tensions in a number of areas. Now, in order to address this, a royal commission was formed to investigate the potential consequences of immigration on different aspects of British society. And there's a number of interesting statements in the report of this Royal Commission that make direct reference to the potential burden that immigrants can represent for systems of poverty relief. So one of the I think they call it the potential evils of aliens would be that they would come in an impoverished and destitute condition, and that they could potentially become paupers and receive poverty relief. A burden is thereby thrown upon the local rates. So that's one interesting idea, because one of the arguments present in literature is that if you don't really need, if people that come to your country don't represent a potential liability, if you don't have to pay for them, then the incentives to actually control access are also smaller. If from the point, and that's the case, this transformation in the late 19th century, where people become a potential liability for the state, where the state takes on a number of more responsibilities to ensure economic and social security of people, then people can become potential costs, which creates more incentives to try to control who accesses these benefits and also who enters your country in the first place. This is the Aliens Act of 1905, which was, well, the first real piece of legislation in Britain that gave the government instruments to control access, especially control at ports, and where immigrants were forced to prove that they wouldn't need to be taken care of by poverty relief. So immigrants were considered undesirable if they cannot show that they are in possession or if in a position to obtain the means of decently supporting themselves and their dependents. So now actually immigrants were asked to prove that they had, I can't remember the exact amount, but 5 pence or something. That sounds quite funny nowadays, where there are these stories about immigrants coming at harbors. They would show the money to the inspector, and then the money would be passed by down the line so that everybody basically showed the same coin or the same banknote. You can see here that immigrants were also considered undesirable if they were lunatics or idiots. Now, what I presented here for Britain is essentially ways of instruments of external control. Now, if we move quickly to the case of France, France was one of the countries that has maintained open borders later than other countries, in a way where a number of countries adopted their first legislation to restrict immigration around the First World War. France has been a little bit different in the sense that there's been, well, France has undergone a demographic transition earlier than other countries, which has led to a labor shortage for quite a long time. There was also an obsession in France with what they call la dénatalité, which is essentially the lack of babies, which needed to be compensated by immigration flows from other countries. If you think about northern France, people being brought in from Poland, for instance. Now, France is an interesting example where it's rather the other instrument, so the internal boundaries that have been built, and this has taken place progressively. The first social laws in France from in the second half of the 19th century would apply to everyone, but then around the turn of the century, you can see the progressive exclusion of foreigners from social welfare programs. This is the case, for instance, of the law of medical assistance, 1893, or old age and disability, where either legislation or administrative regulations would explicitly advise not to treat and not to take care of people who are not French citizens. And this is also the case where here, as French citizenship gains more value in terms of economic security, also these boundaries to divide French people who are entitled to a certain set of civil and social rights gets divided from people who don't get access to these rights. Another example is the law on work accidents, where social assistance or benefits would be paid to the family of workers who would be injured in the workplace, but these benefits would not be paid to families who are based abroad, which basically disadvantaged de facto the many immigrants, especially from Italy, that worked in France back at the time. One of the rationales for this was that the ability of authorities to control families who are based abroad and whether they're actually alive, how many children there are, whether they are dead or not, was just not possible. So that's why also the administrative capacity also plays an important role. An interesting also, and I'm close to the end, an interesting mechanism of de facto exclusion was reciprocity as a mechanism of entitlement. And the reasoning here was that immigrants in France would only receive benefits if their home countries would provide the same benefits to French citizens living there, which de facto was asymmetric, because very few of the sending countries actually provided the same level of social protection as France to their citizens. So de facto, in the beginning, that basically meant that most foreigners would not be entitled to the same benefits as social citizens, or they would be subjected to a number of restrictions or penalties. One example, and this is going to be my last slide, this is a graph that I've taken from the book by Noiriel, which is one of the few that really makes reference to these kind of things, where you can see the expected pension for similar contributions in 1927 when you retire at different ages. If you retire at 55, at 60, or 65, what you can see is that the benefits paid to Italian workers would be systematically lower than the ones paid to French workers. So if you retire at 65 as an Italian, with the penalties that you would be inflicted compared to natives, you would basically earn a little less than a little more than somebody who was retired, a French citizen was retired 10 years earlier. So that's how the subtle ways where these type of internal barriers were built. So this is it. So I've presented a bit of a bit of theory, a bit of evidence, but I'm really here to hear say your feedback and the suggestions about how this can be pushed forward. Also, I'm especially interested in hearing from historians, indeed, where us political scientists are not that good at the handling of the original sources. I would like to thank you for your attention.